Thank you very much for coming this afternoon to an event that we believe is one of the most exciting things in a very long time at WHO. On behalf of the Regional Director of WHO for Europe, Dr. Shoshana Jakob, I welcome you. And I would like to invite you to a not very long, but we hope very interesting session on what we would consider historic results for the World Health Organization. I would also like to welcome specifically panel members. They will introduce themselves a little later in the session. And of course, our UN colleagues from other UN organizations who are joining us today, as well as colleagues in the country offices and in the geographically dispersed offices, who will be able to pose questions to us through Hilde's email. So we will have a bit of a question-answer session a little later. Now, not to lose any time, because time is very tight, I am Claudia Stein. I'm the Director of Information, Evidence, Research and Innovation here at the WHO Regional Office for Europe. We're responsible for health information, statistics, and many other types of information. So we're not actually the people leading the work. The person leading the work is sitting next to me. That's Dr. Hilde Kruse, who is our food safety advisor in the region and who has been closely involved in this work. But I am here because it's partly personal, partly historical, but also professional. During my 12 years at headquarters in Geneva, I was leading this work for 4 years, and when I came here to the regional office, I continued to be involved. So this is a great day for me. A baby that was born in 2006 is finally leaving home, and we hope that you will send it on its way. What I would like to do in the next 10, 12 minutes is just give you a bit of an overview of why we have done what we have done and why we believe that the results we showed today for the first time are so relevant. The results themselves will be presented by Dr. Kruse, and I think this will generate a lot of discussion. First of all, we need to say that foodborne diseases have always been either underreported or unreported. And this is why we feel we needed to get a very good grasp of the actual numbers and the impact of those diseases on humans. So what are foodborne diseases? They are any kind of disease that can be transmitted through the ingestion of contaminated food. And that contamination can be through bacteria, viruses, parasites, prions, remember the BSE crisis, chemicals and toxins, but they also include things like allergies. And we know they're everywhere. There not a day goes by where you don't actually see some newspaper article somewhere in the world about an outbreak. And you can see here it's a lot of different causes that cause foodborne disease outbreaks. But there are a lot of myths around them. One of the myths that I would like to explode with you is the myth why we cannot actually estimate burden of disease. We can, and you will see why. The first myth is people often think, well, these diseases are a problem for poor countries. They have poor food hygiene, and of course they get very sick. And this is not really something that concerns us in Europe. Far from it. Even a few years ago, we knew through surveillance data that in some countries there were high numbers of foodborne diseases from bacteria and viruses alone. In the United States, 15 years ago, there were 76 million cases of foodborne illness. Another big myth is this. These are the kind of diseases you bring home from your travel. You go to Thailand and you eat a dodgy ice cream and you come back with salmonella. Well, actually, the truth is that most of the cases of foodborne diseases in countries in Europe and North America are actually domestically acquired. So a lot of these diseases do come from travel and people have to be careful, but that is really not even half of the story. Another myth that I would flag and that I would call the convenient myth is to say that, oh, that's because the food we eat may be imported from a country where food hygiene is not so great, and this is why we get sick. Another big myth, because in fact rich countries have exported foodborne diseases to poor countries. That is disastrous. Not only are these pathogens that you see here, and dioxin and the prion BSE, something we have exported outside Europe, but exported to societies where people are more vulnerable, where they do not have certainly any immune system that can cope with this, but also are not used to these pathogens. Another myth is, but it's getting better. It's getting better, and we don't have so many foodborne diseases anymore. After all, we have moved on a lot. Well, actually, a letter in the journal Nature showed us quite the reverse. This is a study that looked at new infectious diseases, emerging infectious diseases, some we have never seen before, and they found that over the last 60 years, until the date of the study, that these diseases increased. More and more new diseases were described, and when you look at the detail, you find something very interesting. Of the 335 diseases that they described, 30% were transmitted by pathogens through food. And that is quite a big number. And not only that, they also looked into the reasons why this is. And they said that 50% were due to changes in the agricultural or food industry. So there's a lot happening in foodborne diseases. The picture in the last few decades has not been rosy. And we are also facing now the issue of antibiotic resistance, where we may not be able to treat the diseases anymore due to resistance against those antibiotics. Now, if you then look at the effects of climate change, and nobody has really quantified this in the area of foodborne diseases, we may look at an even more complex picture. Now, this is a very frequent myth. They're saying, well, you may be ill for a day, and that's fine. It's not really a big deal, and they're mild and short-lived, and you get over it. Well, actually, if you just look at the deaths from diarrheal disease worldwide, in a few years ago, when the FERG that I'll present in a moment started this work, there were over 2 million deaths from diarrheal disease. But we're not just looking at diarrhea when we talk about foodborne diseases. We are looking at a whole range of diseases. And when I said earlier, you're looking at bacteria, viruses, parasites, toxins, chemicals. When you just look at this list of the different kinds of diseases that you could end up with, far from diarrhea, many of them extremely serious, many of them fatal. So this is a huge spectrum of different diseases. So they're not always mild, they're not always self-limited, and they're certainly not always short. Some of them last a lifetime. Then there's the hopeful myth. That's one that I wasn't even aware of until I worked in food safety, when people said, oh, this won't happen to me. I don't eat meat and I don't eat poultry. Everybody thinks chicken, for example, salmonella and campylobacter. This will not happen to me. But when you look at outbreaks, many of them were actually associated with products that are vegetarian products. Just some examples here, and some chemicals. This was a scandal a few years ago in 2009, where Chinese milk powder was contaminated deliberately with melamine. But also, everybody will remember this big E. coli outbreak in Germany in 2011 that was due to sprouts, that contaminated sprouts. So you are not safe by just avoiding certain foodstuffs, is what I'm saying. The other one is to say that, and that's the easy one, our governments are responsible. They're the ones who would really have to make sure that our food is safe. And we would fully agree that governments are responsible. And there is a huge exercise, the Codex Alimentarius, that looks at how can we make our food safer at the governmental level. But when you look at the whole chain of where food moves, from the moment that it's produced to the moment that it's eaten, you can see there are many, many players. There is, of course, the environment that influences the food itself. There is the growing of the food, the crops, livestock and seafood, the processing, the storage, the distribution, then retail, supermarkets, and how it's prepared, and then how you eat. So everybody really plays a role, and that is why we have the 5 keys to safer food, to ensure that your food is as safe as possible for you as the consumer, because you can do a lot to ensure that your food is safe. There are some things you can't do anything about. They come from the other side of the food chain, maybe in the way it is produced, but you can also help. And these 5 keys to safer food are something we promote to make your food as safe as possible at your end. Now, this is a dangerous myth, and that's a myth that, in terms of global food safety, is often brought forward, saying, isn't it much more important that people actually have food, and then we think about food safety and whether it's contaminated later? Food security, in other words, is more important. Well, we would argue no. In fact, when you look at these bags of grain from the World Food Programme that was sent by origination to Mozambique, and if you look at this in a bit more detail, you will find that food security without food safety can actually be dangerous. Why? You open the sacks and you find that there is actually mold on the sweet corn. And if you imagine you're in a situation where people are very vulnerable and malnourished, and they actually eat contaminated food, they're much more likely to die. So contaminated food is also very rarely discarded in situations of famine. So people eat contaminated food, and food security cannot be done without food safety, is what we would argue. And there's the big one. There's one that has been so big a while back in the United Kingdom, it caused a scandal, saying our food is perfectly safe. Here you see Mr. John Gummer, who at the time was the Minister of Agriculture in the United Kingdom. In the wake of the BSE scare and the BSE crisis, he fed his daughter a hamburger to demonstrate to the general public that the food is perfectly safe, and even said, our food is perfectly safe, and reiterated that also before a parliamentary commission. Now, perfectly safe is a word you cannot actually really use in food safety. Safe, yes, but perfectly safe, what does that actually mean? Because at the end of the day, it is an organic product. And so much can go wrong from the moment you grow the food to the moment you eat it, that the question really has to be, how safe is our food? And we need to make it as safe as possible. So, how big is actually the burden of foodborne diseases? How many people do get sick? We do know a little bit about it. We know that there are reported cases of foodborne illness. There are surveillance systems that tell us that, but clearly that is only the tip of the iceberg. And that iceberg, as we now know from the data we show you later, is very, very big. And that is what we wanted to know. So when we come to the final myth, and that is an understandable, we can never estimate the burden of foodborne disease. It's so complicated. You have all these different pathogens and these different chemicals, and you will always miss some, which is true. But you've got to start somewhere. And we actually think this is a myth. You can never estimate the burden of foodborne. Yes, we can. And not only that, we have. And this is something we want to present to you today. This is the result of the initiative to estimate the global burden of foodborne diseases. And the group, the very impressive group that has done this, is the FERG. Now, it all started in 2006. We had a consultation at WHO headquarters where we asked 50 experts, do you think we can do this? And do you think we should do this? And they said, well, absolutely. What doesn't get measured doesn't get done. If you don't flag how many people actually get sick or die from foodborne diseases, you will have great trouble persuading policymakers to do something about it, and you cannot assess the effectiveness of your food safety policies and your interventions. You need to have some way to measure this. So they suggested we should start an expert group that really looks at all the different types of foodborne diseases and describes them in great detail. This group is the FERG, the Foodborne Disease Burden Epidemiology Reference Group. And this is the amazing set of people that were leading this group. One of them is with us today, Dr. Tina Held, who also led one of the task forces. And this group of experts, altogether about 100 scientists, have produced over the course of 8 years the results that Dr. Kruse will present. So, this is why we do it. We know we have poor information from foodborne diseases, and we know that policymakers need this information to assess the effectiveness of both prevention and interventions. But also we really want to foster international development and talk about global health security. Global health security is a big issue. At the moment we think in terms of security from terrorism, but make no mistake, it is foodborne diseases that are truly global. It is foodborne diseases that can be shipped from one part of the world to another within less than 24 hours. So this is a big global health issue for security. And what we have estimated is morbidity, disability, and mortality from foodborne diseases, but also develop tools for countries to conduct their own national burden of disease studies. Several have done so, several have even published, like Japan. So, this is what we have, a global and a regional report. We have country burden of disease studies that are out there, and we hope that many others will follow. And this is what they have reported on. These are the many, many hazards that you see. Altogether, 31 hazards that have actual numbers in the various areas of parasites, pathogens, chemicals, and toxins. And these results give us the proportion that is actually due to food. With that, I would like to thank you, but I really want to point out this is a picture that one of the staff in the Secretariat of WHO has taken. She's with us today, Tanja Kuchenmüller, who for a while also led this initiative. And if you can tell me why this is a food hazard, I will give you a prize, because I don't think you will. It's because actually this is the full picture. So when you look at foodborne diseases, it's everywhere, it's out there, and it is here. And unfortunately, we'll not have time for questions now. We will do this later. I would like to hand over to Dr. Kruse to now tell us how bad is the situation actually, and then we'll discuss later what can we do about this, because we can do quite a lot. So thank you very much, and over to Dr. Kruse.
Thank you very much, Claudia, for an excellent presentation and the great introduction to the work that has been going on for several years, and that we are so pleased that it has finally come to an end. So now we have the data, but of course then the work needs to start, and also to take action based upon these data. So I have been given the honor to present the estimates of burden of foodborne diseases, focusing on the European perspective. And I want to emphasize that this is not data that I have produced. That I would like to credit all the 100-something of scientists that have been involved in the process, including Tines, that is sitting here, Sarah, who's here, that has been involved in the work, Tanya, Claudia, of course, the mother of the FERG, so your baby is now being born, yep. And many others. So I will now present the key findings. But I will start with quoting Dr. Margaret Shand, the Director General of the World Health Organization, who has stated that food safety is a hidden and often overlooked problem. Very much true. And we know that foodborne disease, yes, it is a serious public health challenge. We know that already. And more than 200 diseases are spread through food. And as Claudia already mentioned, they are caused by different hazards such as microorganisms, bacteria, viruses, fungi, prions, parasites, or chemicals, radioactivity, or even physical agents. And the different types of foodborne diseases, everything from short-term disease, acute vomiting, diarrhea, to long-term illness. And indeed, foodborne diseases can cause very severe consequences, some of which can be long-term, including kidney and liver failure, brain and neural disorders, reactive arthritis, cancer, septicemia, and even death. And foodborne diseases may be more serious in children, pregnant women, those who are older, or who have a weakened immune system. Dr. Shoshana Jacob, the Regional Director of WHO Regional Office for Europe, underlines that food safety is a shared responsibility. And she has stated that on the occasion of the World Health Day that was celebrated this year and dedicated to food safety, that today the journey from where our food comes from to how it ends on our plate is longer and more complex than ever before. Food safety risks exist at every step. Our food safety and control system must adapt and work together across sectors along the entire food chain. And this is also emphasized in the Health 2020, the European policy framework and the strategy for the 21st century. That sets strategies and priorities in regard to how to address all kinds of health issues in the years to come. And there is very much underlined that we need to have intersectoral collaboration, we need to have health in all policies approaches, and that we need to work together across sectors and disciplines in order to tackle all kinds of health problems, including the food safety issues. The FERG group, they, in the beginning of the work, addressed many different types of hazards that can cause foodborne hazards, where there were sufficient data to come up with estimates for the burden of foodborne disease. And all these hazards can be grouped into 4 major categories: parasites, chemicals, invasive bacteria and viruses, and diarrheal diseases. You will also find a few parasites under the group of diarrheal diseases, so it's not exclusively, mutually exclusive. But overall, these are the 4 main categories. And I don't want to go into details about the hazards, but you see them there. And it varies also between the different regions of the world and the sub-regions, which are the most common and which are the most important. And so some of the pathogens you only find in certain regions, and whereas others you find all over. And so what are the overall findings from a global perspective? Well, a big finding is that the burden of foodborne disease is substantial, and that every year a foodborne disease causes that 1 in 10 people fall ill, and that there are 33 million healthy life years lost. And foodborne disease can indeed be deadly, especially in children under 5 years old. And there are an estimated 420,000 deaths per year globally. And 30% are among children below 5 years old. And it's important to underline again that foodborne diseases are preventable. So these are diseases that we can actually prevent and shouldn't occur. And everyone has a role to play. So again, I want to emphasize what Dr. Shoshana Jakob has also stated, that there is a shared responsibility and we all need to work together across sectors and discipline in preventing these diseases. And again, the main findings globally, 1 out of 10, and that is actually 600 million people that fall ill from contaminated food every year globally. 420,000 die. And as already stated, 30% in children less than 5 years old. And what are the most important pathogens causing death in these children? Those are enteropathogenic E. coli, non-typhoid salmonella, enterotoxigenic E. coli, Campylobacter, and typhoid salmonella. And it's also important to point out that Taenia solium is the dominant parasitic cause of childhood mortality globally. It's also important to emphasize that the burden varies greatly across the world, and that the WHO African and Southeast Asia regions have the highest incidence and the highest death rates. And then we see differences between the different diseases. That some diseases are more common in low-income countries, such as typhoid fever, cholera. Others are more common across all regions and countries, such as Campylobacteriosis and non-typhoid salmonella. Diarrheal diseases cause more than half of the burden of foodborne disease globally. And diarrheal diseases cause that 550 million people fall ill every year globally. And 220 million are less than 5 years old. Diarrheal disease causes 230,000 deaths globally every year, out of which 96,000 are less than 5 years old. Norovirus and Campylobacter are the most common causes of diarrheal diseases. So these are the most common causes, so causing the most incidence of foodborne disease. But non-typhoid salmonella, followed by typhoid fever, is the cause of the majority of deaths and the highest burden of foodborne disease globally. And other important hazards to the global burden of foodborne disease are hepatitis A, Taenia solium, a parasite, transmitted through pork, and aflatoxin, a chemical. So what about the European region? Well, in the European region, every year, 23 million people fall ill from a foodborne disease, and 5,000 people die. Diarrheal diseases are responsible for most foodborne illnesses. Norovirus infection causes almost 15 million cases out of the 23 million people that fall ill. And Campylobacter, nearly 5 million cases. And again, we want to underline that foodborne diseases are preventable. So these are diseases that we could prevent and shouldn't occur. And everyone has a role to play. So each of us sitting here, as individual, as our professional role. Again, main findings from the European region. So more than 23 million people. Out of these, 3 million are fall ill, and out of these 3 million are less than 5 years old. And there are 5,000 deaths. Interesting, children less than 5 years in the European region account for 13% of the foodborne illness. They account for 14% of the foodborne deaths. And they make up some 10% of the population. But they account for 25% of the total burden. So here is where also disability comes into play. So about the healthy life years lost. And we will come back to that. What about the real foodborne diseases in the European regions? Well, actually, they cause more than 22 million illnesses per year. And there were 23 million illnesses of foodborne disease overall every year. So the majority of foodborne illness are diarrheal foodborne diseases. And again, 15 million of these cases are due to norovirus. Close to 5 million due to campylobacteriosis. And there are almost 3,000 deaths per year that are caused by diarrheal foodborne diseases. And there were 5,000 in total. Almost 2,000 of these 3,000 deaths, or 2,000 out of 5,000 in total from foodborne disease, are caused by non-typhoid salmonella. So non-typhoid salmonella is the biggest killer. Overall, diarrheal diseases account for 96% of the foodborne illnesses. So the incidence. Diarrheal disease account for 62% of the deaths and 57% of the disability-adjusted life years, so the overall burden. These slides illustrates the European data and comparing the illness versus the burden. So you see a rank from 1 to 10. So as regard the illnesses, the most common illness is norovirus, followed by Campylobacter, followed by non-typhoid salmonella, followed by Toxoplasma gondii, a parasite, followed by Giardia, Cryptosporidium, Shiga toxin-producing E. coli, hepatitis A, Ascaris species, a parasite, and enteropathogenic E. coli. So what about the burden, the disability-adjusted life years? Well, here we see that there's a change in the order. So non-typhoid salmonella is causing the biggest burden, followed by Campylobacter, and then followed by Toxoplasma gondii, a parasite. And then comes norovirus. Norovirus is the most common, but comes further down in regard to the burden, because it's not that severe disease. You can die of it, but it's very rare. Usually it's an acute disease that you recover from within a couple of days. And after norovirus, it's Listeria monocytogenes that comes up causing a high burden. And you don't see Listeria on the 10 top list in regard to illnesses. And followed by Listeria, there is dioxin that is also causing a relatively high burden in Europe. And followed by Brucella species, a severe bacterial disease, which is not that common, but in some countries we do have a problem with Brucella, and it's a rather severe disease. And then hepatitis A, and then Echinococcus multilocularis, a parasite, which again, it's not common, but it's a very severe, and that's why it shows up in the top 10 in regard to burden. And then number 10, Mycobacterium bovis, bovine tuberculosis, which is also a very severe disease, but nowadays very rare in the European region. A few more words about foodborne toxoplasmosis in the European region. Foodborne toxoplasmosis accounts for nearly 20% of the total foodborne disease burden. It affects more than 1 million people each year in our region. It's spread through undercooked or raw meat and fresh produce. So now we're talking about the food-borne toxoplasmosis. And food-borne toxoplasmosis represent approximately half of the overall burden of toxoplasmosis. And we have prepared a fact sheet on toxoplasmosis that is available in the back of the room that you can also take with you, because we thought toxoplasmosis is worth some more attention and recognition. It's a very severe zoonotic parasitic disease. It's particularly severe for pregnant women and their fetus, because it can cause miscarriage and stillbirth, or it can cause child disability or impaired vision in the child. It's also a very severe disease for the immunocompromised and can cause very severe neurological conditions. And what about foodborne listeriosis in the European region? As you saw in the list where we compared the illnesses versus the burden, listeriosis is not a common disease, but it's very severe, especially among the pregnant women, the elderly, and the immunocompromised. It causes an estimated 400 deaths annually in the European region. It causes a significant burden in the European region. And here is something very important. The burden in Europe is actually at a similar level to the global burden in regard to listeriosis. For many of the other diseases, the burden is less in Europe compared to, for instance, Africa and Southeast Asia, which has the biggest burden in regard to foodborne diseases. But when we start to look at the individual hazards, we see that actually for listeriosis, Europe is at the same level as globally when it comes to burden. And it can result in septicemia and meningitis, and also other conditions. And it's usually spread by consuming contaminated raw vegetables, ready-to-eat meals, processed meats, and smoked fish or soft cheeses. Here are some links that we welcome you to have a closer look at after the meeting. The first is where you find the WHO report of the estimates of the global burden of foodborne diseases. So it's a wealth of information. So everybody who wants to really go into the details, you find it here. And there is also an online tool which is available for you. So there you have actually access to all the data in regard to incidences, deaths, and DALYs globally from the different regions, categorized in different groups. So you can really go and play with it and study it and use it actively, because we want these data to be used for action. So please use them actively and apply them in your daily work and also in your private life also.
Mm-hmm. Absolutely.
And for more information about food safety in the WHO European region, you're welcome to visit the food safety website, as well as the portal on food safety and zoonosis, which you also have links to here. Then I want to end with pointing out what Claudia already also emphasized, that there is a lot we actually can do as consumers in regard to preventing foodborne disease. And that is by applying the WHO 5 keys to safer food. So which are simplified as keep clean, separate raw and cooked food, cook food thoroughly, keep food at safe temperatures, and use safe water and raw materials. And these keys have been translated to more than 80 different languages in the world. And many of the European languages have been, or we have translated the 5 keys to safer food to many European languages. And we have also developed the so-called 5 keys to growing safer fruits and vegetables. So those are the 5 keys to safer food, but particularly applied to the production phase of fruits and vegetables.
Okay. Claudia, Hilda, thank you very much for those excellent presentations. Good afternoon, everybody. My name is David Berkovich. I work at Fleischmann Hillard. We are a global communications agency, and we've been working with the WHO in recent months on multiple report launches. I'm not an expert in foodborne diseases. I'm here to facilitate the discussion around the impact of foodborne diseases in the European region and what more can be done to prevent it. Your role is to engage in the discussion and to help move the conversation from excitement and interest around these unique findings and insights to exploring approaches for positive change, per the title of Claudia's presentation. As Claudia said at the start, this meeting is being streamed online to WHO colleagues around Europe, and colleagues, you have the opportunity to ask the panel questions directly by emailing Hilda Cruz's email address. Before we meet the panel, I'd like to start by briefly recapping some of the key points that we've heard so far. Within Europe, we've heard that 23 million people fall ill from unsafe food every year, resulting in 5,000 deaths. We've heard that non-typhoid salmonella represents the biggest health burden overall, causing almost 2,000 deaths annually. Toxoplasmosis, a severe parasitic disease, also has a significant burden within Europe. 1 million people each year experience it, and this represents the third highest burden of foodborne disease in the region. Norovirus infection, not surprisingly, was perhaps the most common foodborne disease, accounting for 15 million cases, followed by Campylobacteriosis with close to 5 million cases. And as Hilda said, though not so common, Listeria infection has a severe health impact on people who fall ill and was the cause of some 400 deaths. So with that in mind, we've heard that food safety is a shared responsibility. A local incident can quickly become an international crisis, as food is traded globally, from rich to poor countries and vice versa, and does simply not recognize country borders. This means governments, food business operators, and consumers need to understand the roles that they can play and should play to protect their own health, as well as that of the wider community. So with that, I'd like to introduce the panel. And as I do so, ask each of you to summarize the role of your organization in addressing foodborne disease. So if we could start with Camilla Utzon, Senior Food Advisor at the Danish Consumer Council.
Thank you very much, and thank you to WHO for inviting me to come here today. Yes, I work in the Danish Consumer Council. We are a consumers organization with 70,000 consumer members and around 30 organizational members. We work for consumer interests, and I am work with the food-related issues. That would also be other issues than food safety, like nutrition and labeling, but safe food for the consumers is for sure one of our really important topics. We are at international level, we are a member of the European Consumers Organization, FERG, and we are also a member of the Global Consumers Organization, Consumers International, and they're working with the Codex Alimentarius. So we are involved in the discussions about legislation, consumer information, food control systems, and so on related to food safety. Thank you.
Thank you very much. Dr. Tina Hald is a FERG expert and, as Claudia mentioned, senior researcher at the National Food Institute at the Danish Technical University. And if I could ask you the same question, the role of your organization in addressing foodborne disease.
Okay, yeah, thank you very much, and thank you very much for inviting me here. It's a big pleasure, and I must admit, when Claudia was giving her talk, I almost got tears in my eyes, because then I realized that this FERG is suddenly over, and it has been such a big part of my professional life for the past 10 years, so it's really amazing. Yes, I am a senior researcher at the Technical University of Denmark, working at National Food Institute, and I have been working with epidemiology and prevention and control of foodborne diseases and zoonosis since 1996. And a big part of my job and a big part of our institute's job is to provide advisory service to national and international organizations involved in food safety, preventing and controlling food safety. And in that respect, I've also been sitting for 6 years in the biological hazard panel in EFSA. But yeah, I just want to say that I'm really happy to be here, and I'm so excited about the results that are finally coming out. Thank you.
Thank you. Dr. Hugas joins us from EFSA as Head of Biological Hazards and Contaminants Unit. Again, if you could characterize your role, the organization's role in foodborne disease.
Sure. Thank you very much. First of all, also thank you to WHO Europe, to Hilde and to Claudia for the invitation. I think it's a huge amount of work done, and we are so pleased to have it. And also for me, it's also very important to see that for the first time, not only deals with biological agents, but also with contaminants, which is also very important, but very difficult to estimate that. So this is I'm sure that we will hear about this report for the coming years, and I'm also sure that there will be also follow-up actions taken from that. My role in EFSA is I'm heading the unit of biological hazard and contaminants, so the unit that provides support to the biohazard panel and to the contam panel. And there we do risk assessment, we provide technical and scientific support to the risk managers, to the European Commission, but also we support the Commission in designing surveys. For example, for baseline surveys, we're now designing a baseline survey for norovirus so that we can compare, we have a baseline to compare all different member states in Europe, what's a given situation, so then that would allow us also to see if any measures are taken, how the situation would change. And on the other hand, we also produce together with the CDC, we work very closely with the CDC in Stockholm, annually the EU summary report on zoonosis and trends of zoonotic agents and foodborne outbreaks, and also antimicrobial resistance. The one on zoonosis, the annual report on zoonosis, will be published next week. So this is also a very good moment here to contrast also the different findings. And I think that it's a very good achievement so far. So thank you. Yeah.
Great. And lastly, Dr. Klaus Costenza from the Directorate General for Health and Food Safety at the European Commission.
Good afternoon, everyone. Thank you very much for the invite. Even though we are just, the European Commission or the institutions are just representing 28 European states, and the WHO regional office is covering quite a bit more, we are happy to be here to also reflect upon the burden of foodborne diseases. I work for the Commission in the Directorate General for Health and Food Safety. We are maintaining a dense legal framework for food hygiene and zoonosis control. Me personally, I'm working on the control of Salmonella and Campylobacter, on the multinational coordination of foodborne outbreaks, and recently we have strengthened our crisis preparedness efforts because we thought, okay, foodborne outbreaks, but if bigger foodborne outbreaks are coming up, we want to be prepared for it. So it's more on the risk management side, and my favorite quote so far was, "What doesn't get measured doesn't get done." Thanks a lot for all the data to discuss.
Thank you very much. Before we move on to the discussion itself, if you have any questions, we have people with roving mics, so please raise your hand, and colleagues will come to give you pass the mic to you. In usual fashion, please just announce your affiliation and where you're from before posing your question. If I may, I will start with a fairly broad series of questions around foodborne disease in general, perhaps before we get into more specific, disease-specific discussion. So Claudia, you've been with the project, as you said, for nearly 9 years since its inception. What does the report tell us about foodborne diseases in Europe that we did not previously know?
Thank you. It actually told us something that we suspected, but could never really demonstrate. We were always clear that foodborne diseases would kill and maim, even in countries with what we consider very high food hygiene levels. But 5,000 deaths is actually quite a lot, and if you put that into perspective, this is a similar amount to those who die from multiple sclerosis every year in the European region and from acute hepatitis C. So these are diseases people know about and are perhaps more on people's radars. So this is really substantial. That so many people fall ill was also not a surprise to us. But what was interesting, and perhaps also something we didn't quite expect, is that parasites play such a role in foodborne diseases in the European region. Toxoplasmosis and Echinococcus are parasites that not only make you very sick, but can kill you. And I must say, I didn't quite expect that level of parasitic disease among the foodborne illnesses and deaths in the European region. And these are preventable deaths. When you're dealing with diseases where you can only treat symptoms or you can treat a disease but you can't prevent them, that is tragic. But when you actually die from a disease that is 100% preventable, that is tragic. And if we consider that children die from these diseases in our region, I think we have a lot of work to do. And I must say that was something that is perhaps not totally unsuspected, but in this order of magnitude, a surprise, and actually quite a tragic surprise. Likewise, listeria. There has been actually quite a lot in the press about this, about when you're a pregnant woman, try not to eat soft cheese because you may have an abortion. But again, people die from this. 400 deaths? That's as high as in other regions of the world where we always think they have no food hygiene. We're talking about the richest countries in the world, and 400 people die from this disease. To me, that's totally unacceptable. And I think really all players from farm to fork need to do something about this. This is something that we didn't know, we know now, and has to lead to really immediate action.
Thank you. And if I could pose a similar question to Marta, specifically within the EU, is there anything new that this report has uncovered for that region or that group of countries?
Yes, I think that what it's new, it's the real estimation in numbers, the ranking in a way, because also this has been a work that has been ongoing for 10 years. So we already knew a bit of what was coming, and Toxoplasma, when we work on meat inspection in EFSA following a request from the Commission, we already identified Toxoplasma, because also we use many of the same experts, and at the end it's a small world, so there's this cross-fertilization. So these Toxoplasma results are really appealing. I mean, that's surprising that so high. And then also listeria, because on the other hand, we see this mortality in listeria, and we have this. You did the estimation, but we know that now last year in the 2013, there were 2014, 200 deaths, really reported deaths. So then there are many others that go underlined. So I think that's why also this work is so important. But surprisingly, when we go and analyze the foods on the market, we find that a high percentage, more than 99 and even more, comply with the regulation. And then what's the problem? We have a regulation, there's compliance with it. At the same time, we have this high number of deaths. So there's also questions that come from this work that we will need to address in shortly. Yeah.
Thank you. So we've heard unexpectedly high number of deaths, unexpectedly high rates of listeria and parasites, as well as toxoplasmosis. And I guess that brings me perhaps to Klaus, in terms of, from a legislative perspective, what areas for action can be taken perhaps in those three particular areas regarding food safety and management in the EU?
Thank you. Also for us, it's of course a concern, this estimation of the high numbers. So far we have had very clear reported cases via EFSA. We have had estimations on specific pathogens like Campylobacter, but we didn't have this full range of the foodborne zoonotic pathogens estimated. There are some levels of actions, of course. We have already a dense legal framework on the food hygiene and the zoonosis control and the microbiological criteria, which do fulfill international standards and go in some areas much beyond. But there are things to be done. We see increasing numbers of concerns on viruses. So on viruses, also as I said, the myth that the government or the institutions are responsible for that the food is safe. At the end, it's the food business operator that has to make sure that the food he's placing on the market is safe. There needs to be more training done to have this, that he can also comply or live up to this responsibility to include viruses in HACCP systems, for example, to strengthen the laboratory capacities to even detect it. Also to make the good hygiene practices at farming where we are working on, and also to audit them, not just in the member states but also in the third countries. We are the world's largest importer and exporter of food, so we try with our programs, especially with the training programs, to make an influence also on the countries that we are doing trade with. And for example, we do react, for example, when we had hepatitis or hepatitis A or norovirus outbreaks traced back to a specific third country, we do increase the risk-based controls at the border. And that's some of the things we can do. Another issue is also on the traceability, where we are investing a lot in the next years to kind of pinpoint the sources when we have outbreaks and to stop the source as soon as possible.
Thank you. That's a very thorough answer. Tina, looking at the research as a whole, what do you feel needs to be done to secure a more complete overview of foodborne diseases in Europe and indeed at national level, building on some of Klaus's points around the needs for improvement in traceability amongst food business operators and the strength of lab capacities?
Yeah, I think that what we found working with this is, of course, that there are some huge data gaps that would be very good if we could fill somehow. And for many countries is better surveillance of both human diseases, human infections and human diseases, and also of animal diseases, and also what is occurring in food. So an integrated surveillance where there is a coordinated effort between people working both in public health and in veterinary public health. So data from both sides are analyzed together and compiled, because that will give us a much better data foundation to make new burden estimates, but also to actually find out what are the most important sources of these diseases, which is definitely the next step in order to prevent and control. And one step also along this way could be to initiate more national burden studies. There has been a few in Europe, but not many. So that could be interesting, and particularly in those countries where there at this point might be not so good surveillance data, then national burden studies could be conducted instead, maybe. Yeah, and then I agree with Klaus about the traceability of food. I think that could be really important also to, if food business operators, now I don't want to, cast suspicion on anyone, but if food business operators know that their products can be traced back, and everybody report in about it, I think there will be some more
accountability.
Yeah, exactly. So they will take more initiative to actually improve food safety.
Interesting, thank you. Camilla, speaking of, I guess, accountability from a consumer perspective, do consumers know enough? Is enough being done to educate them in terms of prevention of foodborne disease?
I think in general, I would say no, they do not know enough when you're talking about at the global level or European level, or even at the national level. I must say, generally in Denmark, I think we are kind of pretty well educated as consumers, because the Danish food authorities, they're doing a very good job about informing about stuff. But even us, we can also could also know more. And for instance, you always see an increase in foodborne diseases in summertime when people are starting eating outside and doing barbecue and so on. And that is, of course, a sign of that people do not know enough. So we still have to educate people, that's for sure.
Thank you. Are there any thoughts or questions from the audience at this point? Please.
Yes, thank you for this very nice event. I'm Christine Nellemann, Director of the National Food Institute. I have a toxicology background. So when you mentioned Dr. Hilde Kruse, 23 million cases, foodborne cases of diarrhea each year, and 96 could be turned back, or the source was microorganisms. What about the chemical hazards? How well are the estimates of these numbers? Dioxin reached the list of among the illness-causing foodborne agents, but still many others will not, effects right on, but during several years. How do you actually measure that?
Yes, thank you very much. Well, many chemicals were addressed in the beginning of the work, but in the final analysis, there were only 3 that were included, and those were aflatoxin, dioxin, and then cassavesin, which is only relative to certain parts of the world. So in the final analysis, there are not that many chemicals, and more needs to be done also in this area. And maybe, Tina, you would like to follow up? Thank you.
And chemicals or toxicology is also not my specialty, but at least I've been following the work that has been done in FERG on this. And I think it has to be emphasized that the foodborne burden of the chemicals are hugely underestimated in these results, because there's simply chemicals that they were on our initial list that never made it because data was too poor and we couldn't estimate it, and if we tried to estimate it, the results didn't make sense. So we tried both like a top-down and a bottom-up approach, where the bottom-up was more like doing risk assessment using exposure data, and then calculate from there, which gave huge amount of cases, which never fitted any of the disease envelopes that were coming out of the GBD. And then we tried another approach, which were more like estimating from the syndromes that they cause, and then proportion that out on whatever. For instance, if you had a cancer, how much of a liver cancer came from aflatoxins, for instance. Again, there are a lot of uncertainties around this, and this is definitely something that needs to be addressed further. But it is tricky.
Thank you. Claudia.
Thank you. This is a great question, because what this basically does, it emphasizes the point that Tina made earlier, is to say that we really need much better data for some hazards. They're out there. We just could not measure it. And that doesn't mean it doesn't exist. And this is why I actually think also these 5,000 is a massive underestimate of deaths, even in the European region. Some of these effects of chemicals and toxins are very long term, and we may actually lose the relationship between the exposure and the final death. So this is for us also a call for you to really say to people, this needs to have much better data. We need more studies. We always say that, we always say we need more research, but actually, if we really are underestimating the burden of disease from these chemicals, we have not quite finished the job. And I think it may call for another round of this in a couple of years' time, but in the meantime, we need that better information, or we will not be able to ever estimate that.
Thank you. Is there an additional question?
Thank you very much. Maria Wang Hansen from the University of Copenhagen. I'm a professor in parasitic zoonosis. Not surprising, we're working with, among other things, T-Mesolium cysticercosis, and we've just been we're just about to publish a map of cysticercosis in Europe. And this is a CystInNet initiative funded by the EU across Europe, that we try to actually find out what is actually the prevalence and the burden of this disease in Europe. It has been extremely difficult, so I really appreciate also your work. Just like in 2013, we had like 23 cases of cysticercosis diagnosed in Denmark, but that has never been publicly reported. One of the things that we actually really advocate for is notifiable diseases. And I was just wondering what your opinion, or whether you have come up with any recommendation as to how MDs, GPs, should actually go about this, because their databases, as we get, well, we cannot access them if we're not GPs at the moment. So have you come forward in that discussion, or have you actually thought about ways where we can actually make some of these foodborne diseases notifiable and thereby get much better data from sort of MDs? Thank you.
Hilde?
Thank you very much for that comment. Very, very good, and definitely, yes, these data, it's a call for action, and in many areas, and including the surveillance and reporting. And this is also what we are doing in WHO at the regional level, where we are working specifically with the countries in strengthening the policy, strengthening food safety system, and we're working on capacity building and diagnostics and surveillance and reporting. So And these data that we have now in front of us, we will actively use also to strengthen the surveillance system and target our work in the countries, because now we know more about the regions, now, the burden, and we know more about, well, what should we focus on, and we will work with countries in doing that. Thank you.
Claudia.
This is a really great comment, because what this says is you should use the work you're doing and the work we have done to revisit a list of notifiable diseases. That is another really big call to action. And in fact, it doesn't stop there, because revising a list of notifiable diseases, I think, should be based on some evidence like this. And this is why we're also doing this. But in addition, we then need to also work on the systems themselves to improve notification. I have just come back from duty travel to Portugal, where they have an electronic notification system that is so incredibly well linked with all other information about a person that I think this is, in a way, this sort of e-notification system is the way to go. So the content of such a notification, the way this is done, and the way this then informs policymakers in a very fast way is fantastic. And I think that is something that we need to think through across all the agencies, but also within countries across the various sectors that work in food.
Building on the question, is it the case that in some European countries the actual diagnosis is not always accurate or made, and that some people who may be hospitalized may well be written off as having food poisoning? Is that a reality?
It's a number of things. It is, you start from a person maybe not even reporting their illness, not going to their general practitioner or hospital. It then may be that they're not diagnosed. It may then be that it is not reported. It may then be that the reporting is perhaps not good enough to actually include in any kind of system that then reports back to other agencies. There are so many steps in that where it could go wrong. But the most important thing is, of course, that it is recognized, treated, and reported. And that then, once you have reported, you don't stop there. Then you really need policy action. And that is the one thing that we would love to see.
And it sounds like Portugal are a poster child in terms of the notification piece.
Yes, not only in that, they also have a death registration system I won't go into, but it spins me in ecstasy. It's really, they are a country to watch.
Interesting. Very good. Please, thank you.
Anders Dalsgaard, Professor in Veterinary Public Health at the University of Copenhagen. Great report. Look forward to have more time to look into it. Now, there was a mentioning early on about antimicrobial resistance, and among the different lists you showed, I mean, we have a lot of the bacterial pathogens that definitely are becoming more resistant also. So my question is, how have you tried to, or have you tried at all, to build into your DALIs, into your modeling, the resistant levels, which will be very different, different parts of the world? And if not now, how do you see that done in the future?
Well, no, we haven't. But we did talk about it very much in the beginning. But again, due to lack of data, we didn't include it. But it is, of course, indirectly included, because all cases that have died due to an infection that hadn't been treated properly, due to, for instance, antimicrobial resistance, is included, of course, in the estimates. But it would have been great if we had been able to point out how much of the burden was due to that, due to treatment failure, for instance. So that is definitely something that they should be considered doing in the future, because it also is becoming more and more important. Yeah.
Thank you. Okay, if we perhaps move away from the sort of the broader discussion around foodborne disease to some of the disease-specific areas, starting with Salmonella. Klaus, if I could begin with you. You referenced this earlier, actually, that it's recognised that rates in the EU of Salmonella are declining, and that's largely due to EC intervention in food safety management. What learnings might there be from that for broader European countries?
Yeah, thanks. Well, on Salmonella, I always have to preach our success story. We have more than halved it in the last years on human cases, because of the work done by member states and the industry at farm level, at processing level, and also the consumer is taking his responsibility to some extent. I think Denmark, the country we dwell in here today, they were quite earlier, but we kind of managed to follow up on the EU level, but it's also now safer for Danish tourists to travel because of the lower number. We do have, however, we are pushing for salmonella control over more or less globally, because a lot of third countries or like the US, they are seeing that okay, they have the Europeans are doing something that is actually working. We are having quite some exchange, because they're asking, okay, what's the key or what's the silver bullet? With the neighboring countries, we are our trainings with TAIEX or better training for safer food. We are also kind of trying to export this success story, and it's not. Yeah, one of these things was that okay, that we are exporting zoonosis. That was the message there. But actually, that's not true. Because we are not allowed to. If something is not compliant on our market, we are not allowed to export it to any other third country. So if something is not safe here, you cannot just sell it or ship it to Mozambique.
But you
That's
have to know.
You have to know, and if you're not, but at least you're not aware that you're doing it on purpose. Yeah. That's one of the principles of the EU policy, which was a success for the salmonella.
Thank you. Claudia.
But if I could challenge that a little, I completely agree that Europe is a poster child for salmonella reduction, yet 2,000 deaths a year from non-typhoidal salmonella in this region. And yes, we may have stopped deliberate export, but if it is not known or undetected or not reported, then we still have issues. So maybe somebody could respond to these 2,000 non-typhoidal salmonella deaths and say, I feel the job's not done yet. We're on a very, very good road, especially in the European region, but there is still so much to do. This 2,000 should be zero.
Well, on the salmonella, if I remember the Danish data correct, we have more than 50% of our cases are now imported through travel, typically. So, and there was a mentioning it's a domestic problem within. So I would like some comments in particular on that salmonella with that high disease burden. So what is the role of imports here, whether it's import within Europe or from outside? And how much does that account for?
Well, for the Danish situation, it's true that 50% of the salmonella cases are travel-related, but still many of these are from within Europe. So it's not like it's a outside European problem at all. And then I just want to comment on another thing that Claudia said also, and Klaus, and this is about this that food that we export in EU have to have the same standards as should in EU as the food that we export, which is true. But I think that we shouldn't forget that this is like a chain from farm to fork. And a lot of the problems you could say that we might have spread to other countries is really with trade with live animals. Yeah. So it's breeding animals that has had salmonella that has been exported to outside EU and have caused problems there. So we need to think about the whole chain when we talk about particularly salmonella, but also a lot of the other zoonotic diseases where we have an animal reservoir, which is those that are kind of prevalent in Europe.
Thank you. Camilla, on the consumer side, more towards the fork end inevitably, what more can be done in terms of salmonella prevention?
I think actually, of course, I agree this thing about that we should see some of the initiatives, especially in when Denmark was in front as a success story about salmonella, because I think we've got very far there. But as was said earlier, of course, it's a combination that you have to also to educate the consumers and to have a high level of hygiene in the kitchen, but I think it's very, very important this thing about going back to the source and to prevent the salmonella. from the beginning, because you can see that that's actually the only way to get rid of it. And in that perspective, I mean, as a consumer, you don't really have any influence on that. So you can say as consumer, you have kind of to rely on politicians and the food industry and food producers. But of course, you should also have a high level of hygiene among consumers.
Of course, thank you. Hilde.
Thank you very much. I want to emphasize that the European region is much bigger than the EU countries. So, we are talking about 53 different countries, and so which includes all of the Western Europe, Central Europe, Eastern Europe, all the Balkan countries, and all the former Soviet Union republics. So it's a huge region, and very varied also. And the story from EU in regard to salmonellosis is a good story. There is a lot of progress being done. Of course, still a lot still needs to be done, and there are also variations within EU. So I'm sure Marta can talk more about that. But for us in WHO Europe, it's also good to use the case in EU in our capacity building with the non-EU countries, and explain how much you can actually do in regard to salmonella prevention and control by having a farm-to-fork approach, whole food chain approach, working together across sectors to strengthen, so that you actually take action in primary production in the food chain in order to prevent disease in humans, and to strengthen the surveillance systems of foodborne disease in humans, to have better diagnostics, to apply serotyping, to also understand what type of salmonella we're talking about. But this is also very helpful in our policies and prevention and control strategies. And also to strengthen the monitoring in the food chain, in food animals and in the food. And again, with serotyping, good diagnostics, and analyze these data together. And then we learn much more about the epidemiology of this salmonella and where to take action. So we really apply the European experience or EU experiences in the other countries in our region.
Marta.
Thank you very much.
I think it's true that there's been a success story, but it doesn't mean we have now to stop the efforts that we have been putting. I think we have seen a huge decrease in the last 10 years of salmonella, but still we see many cases. Reported cases means that, again, the iceberg is also there, because there are also many other cases that come underreported. We also see changes in the serotype. So as soon as we decrease the serotype, we see other serotypes that emerge, and we see that some serotypes emerge always in similar areas or regionally, so that there's also issues there. We also see difference in the reservoirs. As soon as we decrease in the poultry chain, we see more in pigs. So it's a success story, but still we have to have the alerts ongoing and continuous strengthen the surveillance, the reporting, and also with member states. And it's not all the same, but also imagine that outside the EU also there's a high variance. So it's really we should not load the flag, and we should keep always saying that, putting efforts and really pursuing the further decrease every year in salmonella. But at the same time, we also need to acknowledge that some of the things that have been done in the EU have been successful, and I think that the vaccination was one of them. And we see now that in the poultry chain there's less prevalence, and it has been really a success. So, yeah.
Camilla, final point on salmonella before we move on to toxoplasmosis.
I just want to say that I fully agree about this thing about that we should not let the success story make us be passive and just let it be an excuse for just leaning back and doing nothing, because we actually do now also have a pressure on the European legislative system with better regulation initiatives and focus on burdens for industry because they have so strict rules and so on. And we have this. We also have negotiation with the U.S. for trade deals like the TTIP. So there is actually a huge pressure of what kind of legislative framework we should have, and it's very, very important not to kind of say, okay, this is no problem. We can use this as an excuse for making the legislation less strict and doing nothing. So I think that's very, very important that we should not cut down for the control systems. We should really act still.
Mm-hmm. Thank you. Moving on to toxoplasmosis, which was identified early on as kind of surprisingly high incidence and indeed burden in the European region. Camilla, this is perhaps one that people consumers don't understand well. They're not familiar with it. It's a parasitic disease. It's actually 20% of the burden of foodborne disease in the region. So is enough being done here to raise awareness and prevention?
I don't think the consumers really do not know so much about it, especially not as a foodborne diseases. I think many have heard of this thing about it's something to do with cats and so on. It's something to do with pregnancy and so on. You know something about that when you're pregnant. You should not deal too much with the cat and so on. So actually, yes, there's a need for more information here, I think, especially in relation to food.
Thank you. Marta, if I could ask you, what are your recommendations on addressing toxoplasmosis?
Yeah, we flagged the toxoplasmosis in pigs because we had the results from the Netherlands study that was one of the pioneers in doing that, and we flagged that for meat inspection in pigs. This should be something that should be looked at. We also outsource a project because it's also difficult to identify when a food item can be as positive or not. Is it because it's been exposed to, or it's because it harbors the parasite? Is it the parasite alive? So now I think it will be coming in 2016, the results of this study, which will also give more light of how we can improve also the detection system, the surveillance in this parasite, which is also important for the risk management to then take a follow-up action. So we'll see this thing coming pretty soon, actually, in 2016. Mm-hmm.
Thank you. And Klaus, what impact do you think that those study results will have on EC legislation around toxoplasmosis?
Well, we are looking forward very much to the results of the study, because if you want to control something, then you have to be able to detect it and to do something about it in the end. And if you just know that there's an issue out there with foodborne toxoplasmosis, then you can discuss if there's control options available. Then with public health estimates or burden of estimates help us then to kind of counter-argue the industry's claim of costs that they would have for implementing such measures. But we have to have a better, also scientific picture on the table on how it's actually working and what we can do about.
Yeah, thank you. And Tina, are there any specific areas of research that you think would help beyond the 2016 data?
Well, I think one of the things could also be to have more accurate data on how much of the burden is actually from food and how much is from the cat reservoir, more having contact with cats. Because, I mean, it will, first of all, as Klaus said, right now we don't have really any very good intervention methods without them being hugely expensive for the industry with for instance, preventing toxoplasma in pork. And before, going into that, we need to have a better picture of how much can we reduce by doing it. So even though we have an estimate now on the foodborne proportion, it's still quite uncertain, and I think that we need better data on how much is actually foodborne. Yeah. So yeah, I think that's it.
Thank you.
Yeah.
Great. Moving to Campylobacter, conscious of time. Marta, what do we know about Campylobacter in the European region?
we had a full quantitative microbiological risk assessment in EFSA a couple of years ago, where we estimated also with the help of Tine and many other also Danish experts there. First, what was the burden, but also what were the main sources and what would be some intervention actions. And we estimated also each of these intervention strategies, how much they would reduce the burden of disease. And we passed this information to the Commission, which did then a cost-benefit study there. What we know is it's a difficult it cannot be tackled as it was tackled Salmonella. It's a different problem. We know that the birds' reservoir plays a huge role, much higher than the poultry reservoir, so it's a much more larger. And that the early we control in the food chain, the better. But also that these controls very early in the food chain are very fragile and very difficult to maintain, because anything happening later on can destroy completely what it was done early in the food chain. So, for example, I remember there was a very interesting Danish study on the role of flies and how feeding flies with Campylobacter was also used to spread Campylobacter, the role of thinning in poultry houses, the role of having nets in all the windows of a farmhouse. Of course, this is extremely difficult to implement also in the context of the economic crisis we are suffering in some countries, particularly in the southern Europe, where the prevalence is also higher. So it's not an easy back to control, but I think the Commission is now quite ready to establish some control measures, some metrics in the food chain, and maybe Klaus, you can further explain on that.
Again, this would be for EU member states only. We are putting something on the table right now. We are discussing the first draft of a process hygiene criterion, because we think below a certain level of contamination, which of Campylobacter in poultry meat, we can avoid a certain number of human cases following an EFSA model. So it's about the process hygiene of the slaughter of poultry. In addition, we want to have some supervision from the authority, so that it's not only just the slaughterhouse that has to improve its hygiene, but it's also some kind of follow-up if the slaughterhouse is not complying, and also some feedback to the farms. The third proposal in this would be to talk about decontamination. It's decontamination of food of animal origin in the European Union is only possible after a positive evaluation of the decontaminant by EFSA, and we have one which is possible in beef or beef trimmings, and we are discussing now one for poultry. So there are some measures to be taken that are discussed at the moment, but it's a bit far away from Salmonella. And I'm looking forward to seeing some measures implemented and the results done in the EFSA reports in the next years.
Thank you. Any comments at all on Campylobacter? Okay, in the interest of time, we'll move lastly to the area of Listeria. Camilla, this is a very common hygiene problem in the food processing industry. What more can industry do to reduce risk of Listeria?
I think it's very important to be aware of the risk of Listeria. We saw it also in recently in Denmark, that we have had actually even we have had several deaths from Listeria. And even though the numbers are quite low still, it's very important, because it's so severe, of course, when people are dying. I think it's very important of course to have a really high hygiene standard in the food production section, and I think it's also very you need to have a surveillance and have actually maybe some very low threshold levels for Listeria, because it's really important to keep it low, because the problem with listeria is that they can grow at low temperatures. So low numbers of bacteria can be really a problem for consumers when they store the products in the fridge.
Thank you.
Mm.
We probably have time for, say, 2 more questions. Is that okay, Hilda? Yep. Gentleman in the stripy jumper.
Kai Michaelis, Robert Koch Institute. How diverse are the results looking at different European regions?
How diverse are the results across the 3 European regions?
Thank you very much. There are differences between the 3 regions, and for instance, diseases like brucellosis, for instance, are more common in some of the sub-regions. There are 3 sub-regions that have been, Europe has been divided into 3 sub-regions based upon information about mortality, and also echinococcosis. There is also a difference between the sub-regions, so there are definitely difference there, but it's not straightforward also how the grouping are within Europe also, so we should be a little bit careful to distinguish too much between the sub-region.
Yes. Add to that, the 3 types of subregions for Euro, A, B, C, are not geographic. They are partly geographic, but they're actually, as Hilda was saying, based on mortality. They're the countries with very low adult and child mortality, countries with very low adult and slightly higher adult and low child mortality, and then others with higher mortality. Now, they're not exactly geographically together, so it is a very difficult expression of the sub-regional distribution of these diseases. But because WHO does not operate with the same kind of sub-regions, like, for example, the Global Burden of Disease study at the Institute of Health Metrics, we cannot make a geographical statement here, but it's about mortality. But this can be seen, and this will in due course also be reported. At this point in time, we're reporting only by the major region, but I completely agree with you that this is not enough, and actually what we need is country data. And this is where we need the National Burden of Disease studies.
And we're talking about food safety, but what are the influences of living conditions and social components to contribute to this burden?
That's not only a good question, but I think it would actually vary also from hazard to hazard. And of course, these variations can only really be examined if you look at the micro level and the detail of either a national, I would even argue for a sub-national study. In a country as big as Germany or Russia, having a national number means nothing. So at the end of the day, and we've just come from the Robert Koch Institute yesterday where we had a discussion about conducting a national burden of disease study, that is the kind of level of detail you would need, so you can actually link it to other factors and to other identifiers like income, like education, like your built environment, like other factors. This would be so desirable to have, because then also policymakers would get information as to what can they actually do, because this is not just something for the health ministers or for the food and agriculture ministers, but that is something for the whole of the government, in a way like our Health 2020 policy. It would be wonderful to have that information. This is not really available from the study that we have done here.
Thank you. And I think we have time for one more question. Yes, lady in the black shirt.
Thank you. Lisa Rosendahl in University of Copenhagen. I'm an epidemiologist working a lot in the farms, so I work a lot on the primary production side and with the farmers. And my impression is that even in Denmark, where the farmers are considered well educated, it's often lack of knowledge and lack of understanding of numbers such as these, and also lack of understanding about how the diseases spread between their animals and in general what they can do. That is the main problem about getting progress in the disease control. So I think we have to emphasize the how education and how this can also reach all the way down to the first steps in the chain, how we can use these numbers to be going all the way to the first parts of the chain.
I'm sorry. Sorry, are you able to share your mic? Thank you.
Yeah, my name is Marianne Sandberg. I'm from the Danish Agriculture and Food Council, from the Danish industry. I would just like to ask you, have you looked into the role of water in your work, and even better, the role of water and sewage? And I'm especially thinking about of Campylobacter, which I work a lot with. I don't think the last word is said about the source accounts of Campylobacter. So.
Yes, we did, because we investigated, but again, it is an expert elicitation because we didn't have any global data and very sparse national data on the role of the different major pathways. But we did investigate all the kind of major pathways, so we divided it up into food and environment, water, particularly, and animal contact and human-to-human contact. And particularly for Campylobacter, it was in general over the regions that we investigated, less than 15% that were allocated to water or to the environment. So the vast majority of the burden for Campylobacter, or for the case of Campylobacter, were actually foodborne, according to that study. But it is tricky, I agree completely, because, and we was something, and Claudia can remember the discussions we had. We had huge discussion about how to define this and how to delineate the foodborne and the environmental or waterborne transmission, because it might very well start as waterborne, and then during the process it end up being foodborne. And when we asked the experts that we did when we did the expert elicitation, was actually that it should be on the food at the time of consumption, but maybe minutes before it could have been on the water. So, I mean, that's also how you ask the questions, but we just had to define it at some point. And that's how we did it. But it is, I mean, it's just very tricky to delineate food and water. And then, in the end of the day, it would be also a question on, I mean, if you want to control it, some of the way might be also to control water. So I mean, we should not necessarily look at the point of consumption when we attribute. We should probably go further down the chain. Yeah.
Okay.
Can I ask a short question to Klaus?
Sure, of course. Yeah, I think this might need to be the last one in the interest of time. But thank you.
It's just related to the process hygiene criteria and the implementation. Wouldn't it be a great idea to make a scientific opinion on biosecurity measures right now for farmers?
Huh.
Yeah.
Yes, of course, it's always good to know more on biosecurity. However, EFSA, in the scientific opinion on identifying control options, farm was, of course, included in this EFSA opinion. And then we've had the CAMCON project with the final package, who has given a lot of ideas on how to control the biosecurity as regards Campylobacter with a checklist and with an auditing program. So I think we are quite aware of the biosecurity, even though we did not have the silver bullet on the farm level yet.
Thank you. Well, it's very nearly time to wrap up. I think this has been a fantastic discussion. Thank you. As was intended, these data have clearly identified where action is needed, whether it's across surveillance and detection, prevention and awareness, or resource allocation. But I will pass to Claudia to provide some final wrap-up comments.
Well, first of all, thank you very much for your great question and your interest. The fact that we're over time means there is a lot of interest in this area, and the results have been stimulating. Although I feel that in some ways the baby that was born in 2006 is now being sent out into the world and is an adult and is doing stuff, in many ways I also feel we're really just right at the beginning. And the reason is not just because of the many things that you have flagged that are still uncertain, that still need to be resolved, that require further data, but it's also we now need to actually really start a new type of policy dialogue with governments, with stakeholders, with consumers, with everyone involved in the food chain. For us, this is actually only the start. So Tina, no need for tears, because I think this is really clearly shown us that these kind of results now need to do something. And I think this something goes far beyond policy. It goes into consumer awareness. It also goes into research again. So that's something that I think WHO and the partners will commit to, and say that now that we have this study, now that we have a much better idea of how many people die and get sick from these diseases, now we need to do something with the results, and we need to translate this evidence into policy. We have at WHO programs who work with countries individually to do so. Tanja Kuchenmüller is in charge of this, and I think this is now the new beginning. It's not the FERG 2, but it is the FERG Plus, and I would like to thank you for being part of the FERG 1 and the FERG Plus. Thank you.